This is Report to Wyoming.
This show targets local issues that matter right here in Natrona County, where we talk to real people about their thoughts and ideas. This week I talked to Shelby McMillan. Shelby works for New Vision at Summit Medical Center. It's a healthcare company that focuses on helping people to take the first step on the road to recovery. In this episode of the podcast, we discuss what New Vision does to help address addiction in our community. After talking to Shelby, I went to their website online. You can go there at specialcarecorp.com. I was interested in their page on the cycle of addiction and how addiction starts. It says that most people who consume alcohol don't have a couple drinks at a social event and then wake up an alcoholic the next day. Often several circumstances have to line up that cause an individual to become addicted to drugs or alcohol. And the multiple stages of addiction can occur over a short period of time or take months or years to develop. But the basic cycle an addicted individual goes through is the initial use, then the abuse, tolerance builds, dependence, then addiction, and then relapse. The cycle of addiction starts when the user first comes into contact with a substance. There are many reasons why an individual might try the substance at the beginning. It could be prescription, it could be a social event where something's present, or simply peer pressure. But then in the abuse stage, that's when the individual starts using a substance on a recurring improper basis. This could mean that the individual starts to increase their consumption thereof as a response to anxiety or stress, or they begin taking higher doses of, say, pain medication without consulting a doctor. And it can sometimes be hard to tell exactly when abuse starts to occur, but it can often be defined as the point when a substance is being used for a euphoric response or high instead of for the social aspect of its intended use. When an individual abuses a substance over a long period of time, they begin to enter the next stage in the addiction cycle. And this is tolerance. Just reading the information they have here, in this stage, chemical changes in the brain start to occur, and some of these chemical changes cause the original dosage of a substance to no longer produce the same physical or mental effects the user had originally gotten. As a result, the user increases the dosage or frequency of that substance to try to recapture the original euphoria or high. And while this may work for a while, over time, tolerance to the new increased dosage will inevitably occur. And when this happens, the individual will increase the dosage again, which slowly creates a progression into heavy substance abuse. And then, like I said, dependence. At a certain point, the body or brain becomes dependent on having the substance to function properly or to feel normal. In the addiction stage, an individual will have an intense focus on using a certain substance to the point that it completely takes over their life. So this means that an individual's relationships, job, finances, overall mental and physical health, and more can all be negatively impacted from their substance abuse. Eventually, an addicted individual can come to realize the harmful or dangerous consequences of their substance abuse or grow tired of their life revolving around their addiction. This leads to an attempt to stop using, but sometimes withdrawal symptoms, certain triggers, or other factors in the individual's life may cause them to relapse. A relapse is defined as a downward spiral back into the compulsive behavior of addiction. The relapse stage can be a very long and painful process, and it's considered the hardest and most mentally exhausting part of the addiction cycle. If an individual, for whatever reason, returns to using after trying to recover, they can experience extreme guilt and shame, which can lead to an even more severe spiral than what the individual experienced prior to being sober. During this period, an addicted individual can experience destructive thoughts, mood swings, anxiety, isolation from groups and activities, compulsive behavior, or even returning to unhealthy behaviors and environments. During this stage, an addicted individual can feel trapped, depressed, alone, and out of control. Fortunately, even in the most extreme cases, it's possible to interrupt the cycle of addiction and relapse by getting professional treatment. And that's where places like New Vision come in.
My primary goal is doing what I'm doing today, which is telling people about what we offer. Because believe it or not, a lot of people in addiction don't know where to turn. So I reach out to drug and alcohol agencies and hospitals and media, everybody I can, to try to let them know, hey, we have this service that nowhere else in Wyoming has available. So
how long has New Vision been around?
New Vision has been around for about 35 years.
Oh, okay.
We are new to Wyoming though. And I should also mention, we're the newest site. We're the furthest west. A lot of our sites are out east, and we're the most rural. So It's been a challenge getting like into the swing of how do we function with having counties that are so far spread apart. But yes, New Vision has been around for 35 years, about, give or take, and it came about when two men truly believed that people with addiction and people in active addiction should be treated like they have a medical diagnosis, not a disease. So,
yeah, yesterday I got to write an article, and it was kind of weird because we don't usually write articles like this. I'll preamble, but it was, I'll give you a chance, basically was the headline. Here's your opportunity. And that was because one of our reporters had started this. This guy was caught with a 1/4 pound of meth. Not really that big of a number compared to the numbers we've seen lately. Just today I saw someone who was caught with a pound of meth. We'll see what happens there. But I thought it was kind of interesting that judges, it seems to me, are starting to have that same philosophy where it's like, it's complicated, but it seems to me like more open to ordering treatment and giving a little bit more opportunity to people who are struggling with addiction. And you also hear it from the attorneys who argue that addicts, some of them have these precursors to their addiction that make them more liable to have fallen into the life that they have. So I think it's really cool. It's really neat to see. I'm just covering like the crime end of it, and that's more, political and whatever, but I'm sure that's got to be hopeful for someone like you. And
it definitely is. And I get what you're saying, especially coming from my last position. I worked for the state. And we would see it all the time, where, in the beginning, back in the day, a lot of political parties, judges, attorneys would try to crack down. However, there was a lot of second chances. And I think, honestly, that's like where our company stems from, is that these people do deserve a chance to be productive members of society. And it starts day one with us getting them stable into the right mindset. So I would agree.
Then it's hard, too, because I see the discourse. What's weird about news now, especially with our Facebook, is that, like, I guess in the 1960s, you put something out on the radio. There wasn't the internet, right? But it might be the newspapers. And nobody has a chance to comment on it except in their living rooms to their family. And now we get this discourse from people, which is sometimes it's like polarizing and crazy, but I really enjoy seeing what they have to say. There are commenters who are a little bit more stern and like, okay, this guy got a second chance. He's going to blow it. They're going to screw up. I kind of think that's probably part of that journey for recovery, right? It's got like people are going to screw up. They'll fall down. They have to get back again. What would you say about that?
Mm-hmm. Yeah, I grew up with a lot of family and friends who suffered from addiction, and it's not a one-time fix-all, I think that it's people like me, and I don't mean to sound cocky or anything, but it's people like me or people that work for New Vision or in the hospital who deal with these patients on a daily basis that we're the narrative that keeps it going to where we can say, like, they can be treated, they can be served, they can, they can get better, and as long as they're treated with dignity and as long as they're treated with respect in their addiction, then absolutely they can come out of it.
How did you get into this?
So it kind of fell into my lap. I'm going to be honest with you. I was really burnt out in my last job. I can't say I didn't like what I did. I did like what I was doing. It just wasn't as fulfilling. It was kind of mundane. It was the same stuff day in and day out. And I needed a change. And I wasn't even looking, in this position popped up on my computer, and I clicked one button and they called, and I interviewed the following day and got the position. And the more they kept telling me about it, the more I became intrigued. The more I became like, oh, this is something like I can do. Like I said, I've had family and friends struggle with addiction my entire life. And it was just something that I knew if I loved it that much, I could really try to make a difference in this community. That's honestly how it came to be. It was definitely not intentional, though.
No, change is the spice of life. So, yeah, I'm in about, I think, 9 months into this. I come from a totally different background, teaching and in Montana. Although, listeners, I feel like people come at me for this. I am from Wyoming, okay? But I went to Montana for school, stayed there to teach at MSU for a little while. We had our girls, and we moved back here, but my husband's from Casper. Wow. I need to clarify. What's your, no pun intended, do you have any vices?
My children take up all of my time. So I currently have one on the way and a 3-year-old. My vices, if I had to pick, I enjoy working out. And I enjoy being outdoors with my family as much as I can. We like to go rappel off the mountain, and we like to go camping, things like that. Anything to get us outside, of course, when it's not Casper, Wyoming windy, and we can do those things.
Yes.
That would be my vice.
In the winter, it's kind of hard, though. Are you skiing? No,
so
she's pregnant. Sorry. I'm sorry.
Well, no, but I'm glad you asked because I'm a snowboarder. Honestly, it is just and yes, I'm pregnant, but it's very hard to get up and want to go snowboarding when it's so windy. We try to go sledding. In the winter, there's just not much. I really dive into work in the winter, I feel like.
I'm hoping you can tell us more about New Vision. Like I said, I don't know anything about it. I'd
love to.
It started, you said 35 years ago? Okay.
Yep.
But it's kind of newish to our neck of the woods.
Yep, it is. So, something I should probably clear up for the listeners is a lot of the times when patients go into the hospital and they are in need of a medical detox for drugs or alcohol, it depends on what hospital you go to if they are going to be treated or if they are going to be monitored for a couple hours and then sent back out the door. So our service was specifically designed to, if these patients are asking for this help, we will keep them in an inpatient hospital facility setting. We'll treat them accordingly. And then during that stay, which is, by the way, a typical stay is 3 to 5 days, during their stay, it's my job and my intake coordinator's job to connect the other pieces of the puzzle. So we do the legwork as far as finding them inpatient treatment, outpatient treatment, intensive outpatient, those types of things, even ranging from NA to AA. So we do all the legwork to hopefully prevent them from making excuses, really is what it is, to say, oh, I'm not going to go there because, I didn't know the facility needed this or this or this. And we're like, that's okay, because we're going to provide that for you. So we're eliminating barriers while they're in with us so that by the time they leave our doors, they have a plan in place to not go back to the same environment, to not go back to the same habits, and to hopefully continue on their recovery journey. Obviously, we talked earlier, they're going to slip up and that happens, but we're just doing the best we can to connect the pieces of the puzzle. So that's kind of a brief synopsis. I mean, I could tell you so much more, though.
Is New Vision a nonprofit?
So we are for-profit. We accept Medicare and Medicaid and all private insurance. There has been some talk to receiving some charity funds in the near future, and that would just mean if a patient called us and they didn't have insurance, there would be a donation or some funds available to treat these patients. But that's way down the road. We don't know details on that. So for now, we are strictly for-profit.
Does someone have to, when they're in the hospital, how do they get that connection to you guys? Do they ask for it? Does someone else order it? What is that?
Also, great question. So a majority of our referrals come from the hospital here in town or hospitals throughout the state. And that's because if somebody is hurting and they're in withdrawals and they're detoxing off of these substances, where are they going to go for help? The hospital. So the hospital's calling us and they're saying, hey, we have this patient. Do they fit your criteria? Can we send them your way? And a lot of the times the answer is yes. However, all we need is a patient who is willing and ready to get sober. If they want to pick up the phone and call us and they have heard about our service through a podcast or a flyer, whatever, they're more than welcome to do that. We don't need a referral from an outside party whatsoever.
And so now might be a good time. What's your number?
My number is 307-223-4400. Very easy.
We'll probably come back to that at the end, too.
Probably.
Some listeners are in their car and
yeah,
they're just listening to us on the radio, but it is a podcast, too, but we air it on the radio. So when someone gets a referral in the hospital, then who shows up? What's that next step?
We do like to make sure that this patient is willing to get sober, like I talked about. And in order to do that, even if somebody else is calling and referring this patient, I still have to talk to them over the phone just to make sure, like, hey, do you want to go through with this? Those kinds of things. Do you have insurance? If not, let's talk about options. And then after that, the next step is we are huge on getting patients in same day, because anybody in addiction, if they make a decision, it needs to happen as quickly as possible. So we're huge on getting them in same day. Obviously, if we have referrals coming in from across the state, sometimes it's within the next 24 hours just due to travel. But they come in and they meet with me or my intake coordinator, Malaya, and we do a face-to-face assessment. This is really important in the process because this is where we have to dive into their medical history, what they're feeling that day. It really helps the doctor to determine their medication and their treatment plan for while they're with us.
Everybody's so different. Do you guys treat everything from, I don't know, or what do you treat instead of fishing, I'll just say?
Yeah, no, great. So we have protocols for alcohol, which is our biggest and most popular. Opiates. Fentanyl has also been popular. Methamphetamine or stimulants, and then benzodiazapine. Those are the 4 substances we have protocols for. However, it can be polysubstance, and that just means more than one. And we also help people who are struggling with mental health. I'm not sure how much you know about addiction. You said you know some. But a lot of the times people come in active addiction and they're struggling with their mental health as well. That's very, very common. We can take those patients. We just can't take patients who are homicidal or suicidal. That's something I like to know.
Okay, interesting. So one thing that, like I said, that I don't know, it's, how do I say this? It's ravaging Casper. It's meth and fentanyl, right? But then people tell me it's all big cities. Do you think it's exceptional here? And just theory, I'm just asking not for, if you don't have any data handy or anything like that, but what do you think about it specific to our community?
So in theory, I'm not sure Casper is exceptional when it comes to the use. However, I do think that we do have a mentality here of fix it yourself and don't ask for help and do this in the privacy of your home. And it's kind of like just a shameful thing just because we're the cowboy state and that's what we do. As far as like the substances and meth and fentanyl and how it's everywhere, I do think it's everywhere. I don't know if Casper is exceptional to that.
And when a drug like that gets a hold of people, what are the odds that, from your experience, that they could beat their addiction? It seems like it just really gets its claws into people.
It definitely does. New Vision has a mentality that we don't want to have a revolving door of we're going to help you today and send you to treatment tomorrow, and then you're going to come back to us the following day because you've relapsed. So we try to hold our patients accountable by saying you can't come to us more than once in 30 days, and you can't come to us more than 3 times in 1 year. But that brings me back to the point of, yes, it takes a hold of people, and some people can't get out of it. But I think a big factor in how effective it is how they're treated right when they make the decision to get sober. So if they're treated with dignity and respect and like they're a human right when they make that choice, I think they have a way higher chance of making it a part of their everyday life and making that a life choice that this is how I want to live my life rather than in active addiction all the time.
Do you feel comfortable telling us what that kind of process is like when they do accept treatment? And then what can somebody expect if they sign up for this?
Yeah, absolutely. So they can expect to be treated with dignity and respect. That's for sure if they come to us.
I love that. Yes. No, that makes a lot of sense. It's very important, I think.
Yeah. And honestly, it ranges because withdrawals, there's different severities. Alcohol is obviously the most intense, and it can be fatal. People can have seizures from it. That's obviously what we're trying to prevent with our entire service. But any patient can expect to sleep, finally get some good sleep, which might surprise you that people have come into us and ask for help and they have not had a good night's sleep in years and years and years and years just because they have been in addiction for so long. So finally getting some good sleep, finally getting some good food, and getting back to their normal baseline self. That's what can be expected.
Is it talk therapy? How do you hold people? Okay, she's shaking her head. Okay.
I don't know. I think maybe down the road there could be some talk of getting like therapists in to the service to help like that transition, because there's a lot going on emotionally, mentally. There's a lot going on in those first few days. However, that's not something we offer now. Me and Malaya, my intake coordinator, are good with just leveling with people and providing the help and the resources that we are aware of. We can't force anybody to do anything. We can't tell them, you need to go this route or you need to go that route. Ultimately, because if they don't make that choice, they're not going to follow through anyways. So we just really do our best at listening to them, being present, because it's very likely that up until that point they haven't been taken very seriously. So we just try to kind of be that voice of reason for them.
So for someone, let's say, struggling with alcoholism, they come in, they talk to you guys, and then from there you would refer them to other resources that are specific to their needs.
Correct. Yep. Okay. We're huge on voluntary. As I mentioned before in the intake process, we have to make sure that they're willing and ready to get sober. And with that, because we accept insurance, they have free reign of where they would like to go. And I don't know if you want to get into this, but if they have insurance, that means they don't need to pay for they don't need to apply for a state-funded bed down the road. Their insurance can cover longer-term treatment. So, yeah.
And does most insurance cover, do you know, treatment?
So a lot of them will cover up to 28 days and nothing longer. Medicaid will cover outpatient, but not inpatient.
Now I'm getting in the weeds, but what is outpatient treatment?
So no, that's a great question. So there's outpatient treatment and there's inpatient or intensive outpatient treatment, and then there's inpatient. And I kind of listed them in order from least severe to most severe, or most intense, I should say. Outpatient is kind of, you work with a therapist one-on-one, you attend groups regularly, but not, say, weekly, and you're just kind of surrounding yourself with all things recovery, which you're doing in all steps, but it's kind of outpatient is kind of the lowest tier when it comes to long-term recovery. Intensive outpatient treatment is you're meeting with a therapist regularly, weekly, sometimes twice a week, and you're also attending groups for 3 hours, 3 nights per week. So 3 nights per week for 3 hours a session, and that's group therapy. You're sitting in a circle and you're talking about recovery and how to get better and that kind of thing. And then obviously inpatient is you're in the facility and you're waking up and going to bed in that facility. And so that's kind of a level system.
Okay. So for people who are highly functional in their addictions, they can still manage to work. And so volunteering, I don't know if I'd say volunteering, but accepting help isn't going to interfere with their ability to provide for their family. Correct.
Exactly. Yes. And a lot of patients who come to us actually who are older in age, I feel like they kind of feel like they have a hold on things. So that means when they're leaving us, they just want to go back to outpatient. They want to leave us and they want to do outpatient. They want to see a therapist maybe once in a while and maybe attend a few NA or AA groups once in a while. And that's enough for them. And it works. It just depends on really where you're at in your life and where you're at in your addiction.
Okay. Yeah, because trying to picture it as someone who's just like for your average Joe who's maybe struggling with any type of, like anywhere on the spectrum of addiction, it's got to be so hard to make the time. And then that makes it worse because you feel guilty about having to deal with your addiction when you could be taking care of your children or,
Absolutely.
you know, but there's no Band-Aid for that.
Yeah. And that's a really good point, actually. There are other options to where you're not having to like leave your home. You can do it from the privacy of your home. I mean, we can provide resources for, you know, when COVID happened, everything turned virtual. So there are virtual options for long-term treatment, and I have seen people become successful, but I totally understand the guilt associated with that, and it definitely it can't be easy.
Now, working with addicts every day, how has this shaped or changed your mentality as just a character?
Oh, gosh. I feel like I have been working with addicts since I graduated college. And it's interesting because it's been in different realms. My last role was just super disciplinarian and, you know, you have to fix it kind of thing. And now we're on this side. I'm on this side, and it's like, I'll give you a chance and I'm going to help you through this and you can make it. Kind of more like a cheerleader, you know? And so it's been very interesting to me to see my mindset go from one complete spectrum to the other end of the spectrum, you know?
Do you ever feel discouraged or like just beaten down when people...
Oh, yeah.
Yeah.
Oh, yeah.
How do you... So you talked about being outdoors and in nature and your family, but like just regularly, how do you reset and shift focus to make sure that you're doing your job?
Gosh, you ask hard questions.
Sorry, I've been accused of that before.
No, that's okay. Well, I have a strong faith, and that's ultimately what keeps me going. But I've just seen addiction take over so many families that are near and dear to me. That I just feel like if anybody is going to help these people, it might as well be me. And that's honestly, once I think about that, it's easy to reset and it's easy to regroup and it's easy to continue to give chance after chance after chance. Because we need more people who are willing to do that, honestly.
It makes sense to me that New Vision would be valuable to addicts. Why is it valuable to the rest of us?
Mm-hmm. What I automatically want to say is, why is it important to the rest of you? Because we are helping your family and your friends that, gosh, a lot of people, if they only knew that somebody was struggling with addiction, you know, we're helping these people to return to their communities and be better than they were before.
And like you said, these are the people that see you are people who want to change.
Mm-hmm.
So the fact
Correct.
that there's an outlet for people to go when they're at the end of their rope.
Yep.
And ready to surrender, if you will.
Yep. So there was one thing that I said about how it came about. The service came about.
Okay.
And I just want to, because I said that these two men wanted to bring about this service when these patients were going into hospitals and they were wanting the help for substances and alcohol, that they should be treated like they had a medical diagnosis and not a disease. I should have said and a disease, like both together, a disease and a medical diagnosis, not just you're a problem, we're going to turn you away. We're going to treat you like you have a medical diagnosis.
New Vision at Summit Medical Center is located at 6350 East 2nd Street in Casper, Wyoming. They have two phone numbers here. The Wyoming number is 307-223 and 4400. And another number you can call is 800-939-2273. When a person decides to seek help, the initial phone call allows New Vision staff to complete a screening that takes less than 10 minutes and then send the potential patient's insurance in for verification. Once verified, admission can be scheduled. New Vision has no wait list, and the goal is to get potential patients scheduled for admission on the same day or the following day. Admission is voluntary and patients can self-refer. When the potential patient arrives at the hospital for the scheduled admission, New Vision staff escort them to the office and begin the administration process. This process takes about an hour, and it includes medical history, a physical, a complete lab workup, and a nursing assessment. This pre-screening process will enable the patient to be admitted alongside a personalized plan for treatment. Once the pre-screening process is complete, doctor reviews the information and makes the decision to admit the patient if it's deemed medically necessary. And then the patient, once admitted, is treated by nurses, physicians, and other medical staff. And they're admitted to a regular hospital bed and treated as a patient, just as someone admitted for any other treatment would be. On average, a normal length of stay is 3 midnights, but if the doctors deem appropriate, patients could stay an additional 1 to 2 nights. Once admitted, New Vision staff work with the patient and provide advice and options on the patient's next steps in their continuum of care. Their staff will execute a discharge plan and typically schedule follow-up appointments for the patient upon discharge. New Vision is the first step for patients on the road to recovery. The hospital stay allows them to safely withdraw from the substances and proceed to further treatment in the recovery process.
This has been Report to Wyoming, presented in the public interest by Town Square Media.